Welcome, nurse leaders. Welcome, nurse faculty. Welcome, nurses. Thanks so much for coming back to listen to what I have to share today about what it means for nursing to practice decolonization. In recent years, we know there has been more development of language around race and bias, microaggressions, and health equity. And we've created trainings and workshops so that nurses and nurse faculty really do have a better understanding of what these terms mean so that we may bring the social and racial justice that we desire into this profession. But are these efforts really helping to decolonize the nursing profession? And if you're scratching your head trying to figure out what this means, let me share a little bit more. So, I mentioned recently the ANA's position statement that I co created called The Nurse's Role and Responsibility in Unveiling and Dismantling Racism in Nursing. And in it, we discuss the responsibility of nurses to decolonize the profession. And I want to take a moment to explain what decolonization means. But first, I'll have to share what colonization is. So, according to Sarah Trimbath, a professor at the American University in Washington, D.C., colonialism is a practice of domination which involves the subjugation of one people by another. And what this meant for Indigenous people was displacement and instituting legal and other structures which disadvantaged them then and continue to disadvantage them today. What it means today for any marginalized community is that there is displacement, there's loss of culture, loss of language, customs, and the deliberate erasure of marginalized communities' contributions to our history as a whole. Conversely, decolonization is acknowledging that these colonized systems have had widespread impact on our society and through all aspects of life. That's politics, that's media, and yes, for my healthcare professionals, that's the social determinants of health, where people live, learn, work, play, and grow. Further, colonizing practices continue to invade our health institutions, including nursing. To deliberately undo colonizing practices, we have to act on decolonization practices. According to Wilson and Yellowbird, authors of For Indigenous Eyes Only, a decolonization handbook, they describe decolonizing as the intelligent, calculated, and active resistance to the forces of colonialism that perpetuate the subjugation and or exploitation of our minds, our bodies, and our lands, with the ultimate purpose of overturning colonial structures and realizing Indigenous liberation. According to Batiste and Youngblood Henderson in An Oppression, a Social Determinant of Health, the decolonization process involves affirming and activating paradigms of Indigenous knowledge to reveal the wealth and richness of their languages, their worldviews, the teachings and experiences, all of which have been systematically excluded from history, from contemporary educational institutions, and from Eurocentric knowledge systems. So, in our ANA position statement, one suggestion towards decolonizing the nursing profession was, and we had many, but it was to publicly recognize the profession's historic and pervasive involvement in supporting and promoting white supremacy or white Eurocentric prioritization of all sectors of society and perpetuating practices and models that are racially unjust and violent. In the ANA's racial reckoning statement, they did say that we do acknowledge that from 1916 until 1964, the ANA purposefully, systemically, and systematically excluded Black nurses. And this is just one example of how marginalized communities were forced in or forced out of these larger systems, including our nursing systems. So we have to ask ourselves, historically, looking back, right, so that we can undo these harms, what harm has this really caused? What harm has it continued to perpetuate? And how has that harm reached our patients? And we have to recognize that to end this colonial system, especially in our nursing education, there is a need for widespread change in our curriculum, in the pedagogy, in the ways in which we teach, down to the way that we practice as a nursing body and as a culture. There's so much work to be done to decolonize our profession. I'll surely share more tips and suggestions on what it means to decolonize and ways in which you can be involved in this process. Thanks so much.